Hello there, I'm Mabel Jung, and you're watching the World Healthcare Congress Interview Zone, and I'm so very pleased to have Professor Muhammad Yunus here, and we'll be talking about Grameen Healthcare. Good morning, Professor.
Good morning.
Great to see you.
Good to see you.
Well, I see that you'll be talking with a lot of people during the conference, and it's very important to get the message out that Grameen Healthcare is thriving and needs a lot of different support from different areas. So tell me about what you'd like to see for Grameen Healthcare going forward.
Along with the microcredit that we started 37 years back, we also started focusing on healthcare because these are the poor people, particularly poor women, who suffer the most in terms of deficiency in health and the misery related to health. So we thought we should pay attention to it. We started approaching that subject gradually. So if you look in general in a global way, next to poverty, the real big problem is healthcare. Somehow healthcare around the world has not done the job that we expect from the healthcare to come to the people, make it affordable, make it easy for them to reach out to. But it has not. So far it has failed. So what we tried to do, since we have the network of people, to see if we can bring healthcare taking advantage of this network close to them, to the poor people, to the poor women, to their children, and so on. And we did. And we built up lots of different healthcare activities around us. And then we built them as a business entity. And we call them social business. Because in those kind of businesses, we don't want to make money for anybody. It's all to make it sustainable. We define social business by saying it's a non-dividend company to solve human problems. So the idea when you talk about business, immediately this strikes you that somebody is trying to make money out of you. So here we want to dismiss that idea right away. Said no, nobody's making money out of it. All we are trying to make is to cover the cost so that it's operational, it's sustainable, and so on. So we did eye care hospital, we did clinics, series of clinics. We introduced health insurance affordable to the poor people. For example, in Bangladesh, we take $3 per year per family as a healthcare insurance premium.
Right.
For that money, we give all the health services to the family for the whole year.
How is that possible? How does that work?
It works because, as I said, we have the network. So if you're in one branch, which is about 5,000 borrowers in one branch, if 5,000 borrowers paying $3 each, so you have $15,000 right there. And with that $15,000 in Bangladesh, you can build up a good healthcare system with the doctor, with the nurse, with the healthcare workers, and so on. So that's what we did. Our strength came from that. And then we built up other facilities like nursing college and medical schools and so on and so forth. That idea has rooted, and now we have joint ventures with multinational companies like Danone. We produce yogurt to address the problem of malnutrition among the children. So we make very cheap yogurt fortified with all the micronutrients which are missing in the children. So that everybody can afford, all the children can eat and overcome the malnutrition. We have joint venture with BASF, which is a German company, to produce treated mosquito nets to protect people from malaria. We have joint venture with Veolia, another large company, to produce clean water in the villages, because water is again a big challenge to health care. So we thought we can solve it in a kind of business way without having the pressure of making money out of it, but to make sure it's sustainable, it carries out. That idea of Grameen Healthcare is now being introduced in New York City, because we have in New York City, through Grameen America, we have 6 branches with over 12,000 borrowers in New York City. All of them are women. Average loan would be around $1,500 with an excellent repayment rate, near about 100%. It's actually 99.4%. Repayment rate. So having that platform built in New York City, we are trying to add the healthcare piece into it, so that can we bring healthcare to people. In the United States, which is the richest country in the world, but has a healthcare problem because
Yes.
people at the bottom, they don't get any healthcare.
Not covered by insurance.
Yes, and not covered by insurance. Now some like 49 million people left out of the insurance coverage. So they don't see any health service coming to them. So we want to build it up, how to bring an affordable healthcare system so that they can pay a little bit, like we did in Bangladesh with $3 per year. But similar to that, not exactly $3 in New York City.
Right.
But it will be different. Maybe it will be $40 a month kind of amount that you pay. For that you get all the health services that you need for your family, for your children, everybody. Yeah.
Now, Professor, how big an impact since the start of Grameen Health has it made on people's lives? Can you quantify what a difference it has made? How many people are now getting health care that they couldn't get before because there was no access or no really affordability?
We can talk piece by piece, not as a total picture, like how many patients we have treated in an eye care hospital. We started out with one eye care hospital and it come to break-even level. Then we create another one, so we have the second one, now we have the third one. So we keep on expanding the outreach of the cataract hospital. Each hospital has the capacity to have over 10,000 cataract operations per year. So that's a number that you get from each cataract hospital. And it's self-sustaining. It doesn't depend on donor money or anybody else's money. It generates enough income to continue its services and so on. So gradually we keep on adding more and more. Nursing college, same way. The first nursing college will be coming to the break-even point by 2016. Once we get there, then we start setting up the second nursing college or the third nursing college. So you have a string of nursing colleges, and it produces children from Grameen families to become good quality, world-class nurses so that they can work in Bangladesh, they can work in outside. So each piece have an impact.
Yes.
And we have the clinics which takes care of the patients and so on. We have this yogurt which sells yogurt and children coming out of malnutrition. So you can add those numbers, what it means, but I cannot give you one blanket number to cover everything else.
How big a difference will it be to build this in New York City? It's such a, you did amazing things with Grameen America for sure. Is healthcare a different model?
It's different. At the same time, it thrives on the spirit of the other model, the microcredit model.
Okay.
So it's all interlinked. There's a close connection between the two. You use the community building that you have done, so it becomes easy to provide those services. And one thing good about the New York healthcare program, that the entire health professionals in the city are very interested to do something, but their own structure doesn't allow them to get out of the structure and do something for the people who are left out.
Yes.
So we provide them the facility and they get excited, they extend their support and so on. So we need to build that network of health officials, people who are interested in bringing healthcare to the poor people in New York City. Because once we can build up the prototype of that, if it works, if it's self-sustaining, then it is an answer to most of the problems in Bangladesh, not in Bangladesh, in New York City and in the United States, because what is happening in New York City is the same in any city, anywhere in the United States. Right. So if it works in New York City, it will be available to other cities. For example, when we did the Grameen America microcredit program, while it's working in New York City, other cities became interested.
Yes.
So we now have branch in Omaha, Nebraska, we have branch in Indianapolis, we have branch in San Francisco, in Los Angeles, in North Carolina, and so on,
Amazing.
Charlotte, North Carolina.
Right.
So that way, as microcredit is expanding, healthcare can also tag along with the microcredit and produce that system in those cities also. But we need to establish it beyond any suspicion that it works and it's sustainable.
And do you envision it starting in those same cities that has a bank as a Grameen America branch?
Branches, yeah. Right.
Very exciting. Okay.
Yeah, both of them go simultaneously together, so that it draws the strength from each other.
Right. Professor Yunus, exciting news. We always like to get a check-in with you. Thank you so much for your time today.
Thank you.
Thank you. And I'm Mabel Zhang. Thank you for watching.